stones in CVD. MPD is the main pancreatic duct. Now, pancreas is located retroperitoneally, extending from the concavity of the duodenum to the hilus of the spleen. Over here, and the spleen on the left side. The tail of the pancreas is there. That's why when you are doing splenectomy, you have to be very careful when you are clamping the splenic artery and vessels in the hilum of the spleen. You see the tail and dissect and move the tail with a retractor and then do splenectomy. এটা histology show কোনো factor না. You might be thinking that I'm talking irrelevant. No. এই যে your testicular descent, today's that you see it is done. And you will face day to day. You might be andrologist, you might not be. Kota andrologist ache India te. MBBS, a good MBBS is a good postgraduate. এই স্লোগানটা জপো, মালা জপো। আমি একটা 1.5 hour film তৈরি করছি of my work. But those days are gone, I agree. But you have to send your friend who is a plastic surgeon. Then you have to know why you are sending. Refer to Kolkata. Then the patient will search the whole of Calcutta where place and get lost. Anyway, it is not that. The more you are now Aadhaar, you know, colors. Anyone gives an input, take it, put it. It will be very much useful in your later life. See, a testicular pain, epididymis, is coming with an umbilical complaint of pain in the umbilicus. The first thought goes in it might be the appendix. It might be the umbilical means in the retroped or in the abdomen, the mesenteric lymph nodes also get inflamed. When you sit down, you see your flow chart. Now that flow chart is what? One, that goes on. Now, similarly, when you are thinking that you are not finding a testis, don't take it casual. If you are seeing an appendix, you please remove and especially the male, you put it down below the scrotum and feel you go for arthritis or epididymitis or the pain in the varicocele, and then you accordingly go for the diagnosis. When your patient is coming in, you have to have one, like a machine gun. You shoot. I want you to, the more you talk to yourself and talk with your book, your information gets gathered and stored. Individual is different. One person with pancreatitis comes to you. Mostly we think that a person who drinks too much, drinks alcohol and all, that is one of the stimulant or factors which can that happens to the pancreatitis. Now, it might be that you ask him, daru pita hai? Do you drink? Na babu, ami to khai na. And he is having pancreatitis. It can be a stone, it can be some other factors. Now, so you have to question yourself. You have to know your normal anatomy. That's why I put a poster there. It is my slogan. Anatomy is your gateway to medicine. That's my slogan. Because I'm giving you an example. A boy, a person is junior to me, naturally, I'm telling you, very junior to me. My student's friend in AIMS, Delhi. Now, he worked in the Department of Anatomy for 2 years or 3 years. Then he has a network of diagnostic centers in Delhi and Haryana. He left his AIMS tag. Tag is not left, he writes in his pad, AIMS, Delhi. Now, what I want to say is that you can switch over to any part of anything. So you just sit tight these 5 months, 4 months and work, read. Evening, weekend you do. But don't go frequently, go to home. Don't phone karo, kotha bolo, bas. Pancreas now, now the pancreatic ducts, the exocrine part of the pancreas is drained by pancreatic duct, of which the axillary pancreatic duct of Santorini. Now, relationship of the hepatic, pancreatic and cystic ducts are openings of the ducts in the second part of the duodenum. Now, this is the condition. The pancreatic duct moves and your CBD, common bile ducts, open into the ampulla of Butter is a small opening. So there can be a stone lodged in it. It can be a small tumor of the papilla of the your ampulla of Butter. Now, these things bring changes. Now, if there is a stone or some, even due to some growth on the head of the pancreas, that can be eliminated by, diagnosed by your ultrasounds, CT, your MRI, whatever. But tool is ultrasound, first, diagnostic tool. Now, most of the thing is that now the stones are there, then you do what? You don't go for direct exploration. You do a GI endoscopy and ERCP. You remove the stone. If you cannot negotiate, you cannot take out the stone, then you have to go for open. But there is stasis. So there is stasis of bile by the obstruction of the stone or the tumor. Then the gastroenterologist, he puts a stent. So the biliary drainage is gone, the jaundice is reduced, then major surgery, it can be a bypass, the duodenum and stomach and this is, and gets united, made direct opening into the common hepatic ducts also. There are some major surgery, very great surgeons are done by. Now, what you will see is that the histology of the pancreas, now it has a covering of capsule. Now, a capsule, a thin layer of loose connective tissue forms the capsule of the pancreas. Septa extends from the capsule into the substance of the gland and divide the pancreas of the gland into ill-defined lobules. Here is a loose connective tissue. Now, this goes into direct like this, septa, and these are the lobules. When the dead body dissection will be done, you see the pancreas, feel the pancreas, you can see the lobules, you with your own hand, you feel it. And don't blame anyone. যে আমি ভিড়ে দেখতে পাচ্ছি না, আমি এটা করতে পারছি না, এত ছেলে. So don't. Feel, touch. Similarly, see. You have the slides. You please see in 10x first. you see it in 10x, then you adjust. You can go to 40x. 40x, it's sufficient, you can see, and the exocrine pancreas and endocrine pancreas, islets of Langerhans, and pancreas of the pancreas divided into two components according to its functions, exocrine pancreas and endocrine islets of Langerhans. Now, histology is the pancreas, exocrine pancreas is the serous gland. Exocrine pancreas is a compound tubuloalveolar serous glands, pancreatic acini. Pancreatic acini, serous acini, round or oval in cross section in small lumen. Lining epithelium, simple columnar epithelium is lined. The serous glands of the exocrine pancreas. Can you hear me? Okay. Now, cells have narrow luminal surface and broad basal surface. Nuclei are spherical and basally placed. H&E staining secretory cells show basal basophilia and apical eosinophilia. Basal eosinophilia is due to rough endoplasmic reticulum, where apical eosinophilia is due to numerous secretory vesicle zymogen granules, the Golgi apparatus. Germinal granules, centroacinar cells. Concept: acinus is a balloon with straw of centroacinar cells. Now, exocrine pancreas, the duct system of the pancreas. Histologically, exocrine pancreas shows following ducts: intercalated, interlobular ducts. Interlobular ducts, the main accessory, and the pancreatic ducts. Intercalated duct, these are interlobular ducts that begin in the centroacinar cells. They are lined by simple squamous to very low simple cuboidal epithelium. There are no striated ducts in pancreas. The striated ducts are present in parotid gland. Now, difference between you given in the same day, you are given a parotid gland and your pancreas. Out of 5 slides, it might be that you are getting it. So, you don't get a striated ducts are present in parotid gland. So, if the ducts are striated, then it's in parotid. Now, intercalated ducts open into interlobular ducts that are lined by cuboidal, low columnar epithelium. Main and accessory pancreatic ducts are lined by simple columnar epithelium. So, the serous gland, and it is simple cuboidal epithelium, squamous cells. Then your pancreatic ducts are lined by simple columnar cells. Here's the picture. See, histology of pancreas, low magnification. This is a practice figure. This is a practice figure. Now you can see the serous acini over here, and this is the intercalated duct. This is the cluster of cells, the pancreatic duct. Now this is the blood vessel here. You can see the serous acini, interlobular connective tissue. These are the lobules. These are the lobules. Now this interlobular connective tissue. Yeah. Okay. Now intercalated duct, interlobular duct, and pancreatic islets. So you see in between pancreatic islets. But pancreatic duct. See the acinar cells, spherical nucleus, zymogen granules, centroacinar cells, intercalated duct, interlobular duct. Now, endocrine pancreas consists of numerous small clusters, group of cells or islands that are scattered in the parenchyma of pancreas. These are the cluster of cells are called the islets of Langerhans. Human pancreas contains about 1 million islets, 1 to 2% of the volume of pancreas. H&E staining islets of Langerhans consists of cluster of pale staining polygonal cells with numerous capillaries. These islets are surrounded by serous pancreatic acini. Dark staining. Viva. This is Viva question. Okay. Note, on H&E staining, cells of the islets of Langerhans cannot be differentiated. Now, this you need for islets of Langerhans, you need a special stain. Okay. Now Mallory-Azan stain with Zenker's formal fixation. It reveals 3 types of cells: red A, alpha cells, brown O, beta cells, blue delta cells, alpha, beta, delta cells are there. It will be a question, short question or MCQ. Okay. Now, immunohistochemical staining methods, that is immunohistochemistry, that we need not bother. So, now this is a, you picture, you have to at least visualize. We might not, we don't have that facility, or for MBBS, we don't go for special stains. Okay, but you have to, इसमें रटना है, mug it up. But you have to know in Viva, what is the islets of Langerhans? What are the different types of cells? Alpha, beta, delta. It is that. Now, I will see, this is a this is a photograph of the photomicrograph, histology of pancreas, low magnification, H&E. And photomicrograph, histology pancreas, high magnification, H&E stain. This you can see. Okay? These are the functions and this thing. Now, one thing I tell you, you go there, there are 5 slides, open your histology book. এনেছো histology বই নিয়ে আসছো? কে কে এনেছো বলো তো, হাত তোলো। এই একই কথা বলছি। You have any histology book with you? Who are having or who are not having? You are not having histology atlas or histology book? You are having. Okay. Who are not having? Okay, if you are not having, don't get this thing, but your the books by Indervir Singh, Vishram Singh, though they have a description. You take the picture or see it in your one of 2 books are there in your thing. I'll give 2 books there, atlases. You see it, practice, rough diagram, which I told you earlier classes, all the classes I'm saying that you don't know, you just see view